I am Anna K. Lykin, and I'm going to talk to you about shock, different types of shocks, and presentation of patients who are experiencing the various shocks. You might ask what shock is. As a reminder, shock is a life-threatening condition due to inadequate oxygen and blood to the body's vital organs and tissues. The types of shock that I will be focusing on are distributive, cardiogenic, and hypovolemic. Now, distributive shock occurs basically because of abnormal vasodilation. The body is not compensating due to the rapid widening of the blood vessels, which will result in a drop in the blood pressure. Distributive shock has some semi-headings, I would say, or other types of shock falls under distributive shock. These include septic shock, anaphylactic shock, neurogenic, and psychogenic. Now, septic shock deals with bacterial infection of the bloodstream. Anaphylactic shock focuses on severe allergic reaction. And psychogenic has to do with any alarming issue that might result in the patient fainting. And neurogenic deals with any issues of the spinal cord and the brain. Patients who are experiencing distributive shock, you might hear them complaining of issues that involve more than one body part or one body system. This may include difficulty breathing, gastroenteritis, hives on the skin, pneumonia, and also UTI, urinary tract infection. Now I'll move on to cardiogenic shock. Cardiogenic shock occurs when there is a problem with the heart, which is the body's pump. This can be due to any irregularity as it relates to the rhythm of the heart. It can be due to muscle issues or the basic structure of the heart. For persons who are experiencing cardiogenic shock, you might hear them complaining of chest pain. You might observe jugular vein distension. You might also hear them complaining of respiratory issues, difficulty breathing. There might be low cardiac output. So those are a few presentations that patients experiencing cardiogenic shock might have. Finally, I'll talk about hypovolemic shock. Now, this shock is due to low volume of blood and low volume of fluid in the body. This can be due to any form of trauma and dehydration, severe dehydration of the patient. Um, a patient experiencing hypovolemic shock, you might observe dry mucous membrane, low jugular venous volume. The patient may be cold and clammy, and there will also be an obvious delay in capillary refill. That's it.